Patients with migraine who have chronic migraine now get put on one of these new drugs, and they work. Half of them, perhaps more. And they no longer make that 15 episodes per month criteria. Do you reclassify them now? They don't have chronic migraine?
No.
Why?
Because their biological predisposition is chronic migraine, and they've regressed to episodic under treatment. And the problem we now have is the fact that I tend to give them two diagnoses, chronic and episodic migraine. And here's what's even more important. One of my friends is actually in a population-based study, looked at the number of headache days per month in a large number of individual patients. And what he shows is it's like this, up and down. And that many patients, 1 month will have 17 headache days, the next month they'll have 6. What do you call them? So basically what we tend to do is take the words, call it chronic migraine, and give them two diagnoses and just show, or you could call it chronic migraine in remission. But you have the biological predisposition to chronic migraine, that should be the overwhelming diagnosis.
I suppose that makes sense in the sense that other diseases do that. Someone with hypertension has hypertension, even though on
You
medication.
call it controlled hypertension.
Controlled, because you give them meds
Yes,
and the blood
that's
pressure
what
is
we
normal.
So if somebody had a myocardial infarction, angina, and you have a medication that's taken their symptoms away, does that mean they no longer have angina or heart disease?
They don't have angina symptoms, but they
That's
certainly
the,
have
that's the way we look at it.
Fair enough. So, do you have personal experience now with patients in whom you've given this medicine, who have had the diagnosis established of chronic migraine, who now are chronic migraines in remission, if you will, fewer than 15 per month?
Yes, tons of them.
Tons of them.
Tons of them.
Why
I
aren't
have
you
some-
smiling?
What?
You're not smiling. It's
Well,
good.
it's a miracle. I mean, I have patients, as I said, we give them a shot, they come back 2 months later, they haven't had a headache. So that we have, it's all over the spectrum, but we've had people who have 50% relief, 75% relief, and even 98% relief. It's all across the spectrum.
What are you seeing from your friends?
So that's actually interesting. So we have, it's not uncommon to see someone who's new to my group come on, their first post is, I'm a little different than the rest of you. I have all these comorbid conditions, I've tried all these medications, I have a migraine day almost every day of the month. Is there any hope for me? So first of all, them discovering that they're not different. There's so many of us, and that there are so many who actually are like this and are responding to the medications is, to put it frankly in layman's terms, it's mind-blowing that people who have lost all hope actually can have hope now. It's huge.
From your perspective, the two of you, does it make a difference? Do you change the classification from chronic migraine now that the migraines are fewer than 15 a month? Do you call them something else?
Well, from the employer standpoint, of course, we rely on the physician that's taking care of the patient. So the employer is not going to change the diagnosis.
Okay.
No, and it's a sign of success, right? So, no, I think.
So we
But
like
in
it.
Europe, listen to this.
I'm
My
listening.
friends tell me, if you go from chronic to episodic headache, they stop paying for your drugs.
That's where I was going.
Yes, in Europe, that's what happens.
Because that, it seems to me cruel to do that, no? I mean, look, this drug worked, it made you better, we're stopping the drug.
Wouldn't that also be true in America with Botox as well?
Yes.
Because you have to be classified as chronic in order to get Botox.
Well, I would beg to differ. I did all the clinical trials and did the first Botox study, and we clearly showed at the beginning that Botox did not work in episodic migraine. That's the reason why.
Right.
And there's a subset of migraine patients, what we call high-frequency episodic, in whom it may work, and it probably does work, who haven't been studied, and we don't know the reason why.
Right.
So therefore, that's where the separation between episodic and chronic began. Before that, all migraine drugs were approved for migraine, and when we had the trials for Botox, we got the approval for chronic migraine, because those are the only studies that separated from placebo.
Right. Also, my understanding is that the difference between chronic and episodic isn't entirely just picking a number, but from a teaching I recently heard from the Mayo Clinic is that the cortex of your brain actually changes. So
You know where that came from? Richard Lipton and I sat down and had a few drinks and came up with it.
How many is a few drinks?
Let me tell you, there's a major problem in headache. In most disorders, a chronic disorder is something that's been present for a finite period of time. In the headache world, cluster headache becomes chronic when it's 11 or more months. In the migraine world, it has to do with monthly frequency. Our original term wasn't chronic migraine, it was transformed migraine. But people didn't like the term because chronic is really not what we're talking about. We're talking about somebody who's going from low frequency headache to transformed migraine with most of the time. And the problem we have is chronic is used in so many different ways in so many disorders.
Right.
That's the problem.
Right. And even if you're episodic, if you have episodic migraine, you have a chronic disease.
That's the problem.
Right.
You have a chronic disorder with episodic manifestations. It's difficult use of language. So sometimes they use the little c and the big C.
You know what I'm hearing from everybody here, disagreements notwithstanding, is that as with so many other diseases, the introduction of these new biologics has changed everything. Everything.
That is correct.
And we're not even on the edge of the verge of the precipice.
That is correct.
We're just seeing little nibbles at this. This is a new era.
That is correct.
This is new medicine.